And India Today has accessed the first government study on the second COVID wave in India. This report, and I'll just break down some of the highlights for you. It says that despite 56% of Delhiites having antibodies against COVID, the high, in fact, transmission of this virus led to a surge in cases. And they've highlighted that the transmissibility of the Delta variant was more than 50% over the Alpha variant of the virus. Also, the government study has highlighted that higher fatalities were because of a stretched healthcare system and not just because of the Delta variant. They've also highlighted that this Delta variant is 50% more infectious than the Alpha variant. Sneha Murdani is joining us to break down more details of this. Sneha, good morning. Going by the information that's been put out by this government study, and correct me if I'm wrong, what the government study seems to indicate is that the Delta variant is more infectious but not necessarily deadlier.
Yes, Akshata, good morning. You're right about that. The study that has been done by INSACOG and the National Center for Disease Control clearly underscores that this is the variant, the Delta variant, which is the B.617.2 variant, the particular lineage of 0.2, which actually took over North India, particularly Delhi. It did not take over Punjab. This was the main reason actually behind the surge in cases in the national capital from March, April onwards is what this report. This is a government study and this is what it seems to be indicating. 50% more transmissibility by far. Before the genome sequencing of this particular variant was done and it was discovered that in Maharashtra in September, October last year, it was believed that the UK variant, which is the Alpha variant, B.1.17, was the most infectious variant of SARS-CoV-2, the virus that causes COVID-19. But after the study, it's very clear that it is indeed the variant which has been first sequenced in India, if not the Indian variant, is extremely transmissible. However, the study says that if you look at the case fatality ratio, you'll understand that the case fatality ratio continues to be higher in B.1.17, the Alpha variant, and not so much in the B.1.617.2.
Okay.
Which then brings us to the conclusion that this is not really causing more deaths, and the deaths were caused because of the entire collapse of the healthcare system seen in the national capital. It's also the reason, Akshata, behind breakthrough infections. Not one, not a single breakthrough infection was seen in the case of a person infected with the B.1.17 variant, but all the cases the scientists have now been saying in this study point out was that the breakthrough infections were caused by this particular, the Delta variant.
Very interesting. And you know, these takeaways, Sneha, clearly will help in also ensuring that if there is an inevitable third wave, it will help perhaps the government be better prepared also to deal with these variants. Sneha, thank you for those details.